Imagine this. It's just a busy Tuesday morning at your small physical therapy clinic. Routine stuff.
Right.
You've just submitted a batch of claims to Medicare, expecting payment like always. But then, bam, a denial notification.
Oh, boy.
Then another one, and suddenly your whole billing system just stops.
Yeah.
What started as a normal day turns into this, full-blown financial nightmare.
Yeah, that's a scary scenario.
What happened? Well, more often than you'd think, it's this silent threat that many practices just overlook until it's way too late. Federal exclusion lists.
Exactly.
So for this deep dive, we're really going to unpack the critical role of SAM.gov and OIG monitoring for healthcare providers, especially, for PT, OT, SLP clinics. Our mission today, to figure out why these lists are so vital, what they actually are, the frankly severe consequences of ignoring them, and, most importantly, the steps you can take right now to protect your practice, your financial health, really.
And it's not just theoretical stuff. For a clinic like you describe, overlooking these checks, it can mean denied claims, huge revenue loss, maybe even having to close down.
Why?
People sometimes think, oh, that's for the big government suppliers, but no, it's crucial for every provider. The stakes are just incredibly high.
Okay, that's a powerful start. So let's go back to that hypothetical PT clinic. Why would a small outpatient place suddenly just lose its billing privileges? It seems drastic.
It is drastic, but it's very real. The basic reason is this. If anyone, an individual or the whole company, shows up on either the SAM.gov list, that's the system for award management, or the HHS OIG exclusions list.
Okay, the OIG list. Got it.
Right. If you're on either, you are instantly barred. No reimbursement from federal healthcare programs, zero.
Instantly.
Instantly. It's not a payment delay, it's a full stop. Any service billed to Medicare, Medicaid. If someone involved in that service, the therapist, the biller, even the owner, is on a list. Payment denied. Period.
And that idea that small private practices think, oh, this isn't for me, it's for the big guys. That's a really dangerous way to think.
Absolutely dangerous. It's a huge misconception. Oh, that's for defense contractors or whatever. No. Being on an exclusion list means no payment. Full stop. For any services billed to federal programs.
Doesn't matter if you're big or small.
Doesn't matter at all. Solo practice, big hospital system, the rule's the same. The government just won't pay if there's an excluded party involved.
And the ripple effect. I heard that CMS, the Centers for Medicare and Medicaid Services, their rules say if any provider, owner, or even just an employee is excluded by OIG or barred from Medicaid, CMS must revoke Medicare privileges for the entire practice. Is that really true? One person takes down the whole ship.
That's 100% accurate, and it's maybe the most critical point people miss. One single exclusion can pull the plug on the entire operation's ability to bill Medicare. CMS rules are built around protecting federal money, and they have zero tolerance here. If anyone connected, employed, owns shares, anything pops up on these lists, the practice's Medicare billing is gone.
And it doesn't stop there, right? You mentioned private insurers.
Exactly. That ripple keeps going. Many big private insurers, your Blue Crosses, United Healthcares, they often have clauses in their contracts that basically mirror the federal rules.
Wow, okay.
So they can deny payments to or even kick you out of their network if they find out you've got an excluded person involved. It becomes this cascading failure that can just financially ruin a clinic.
That domino effect, yeah. One exclusion, tipping everything over. It really shows how serious this is. You mentioned two lists. Let's break those down. The OIG list and SAM.gov. What's the difference, and why do we need to worry about both?
Great question, because checking both is non-negotiable. Think of them as two layers of protection for taxpayer funds.
Yeah.
First, there's the HHS Office of Inspector General, the OIG. They maintain the list of excluded individuals and entities, the LEIE.
That's the one most people in healthcare might have heard of.
Probably, yes. It specifically bars people and companies from federal health programs, usually for things like fraud, patient abuse, maybe certain felony convictions.
Okay. And the other one, SAM.gov.
Right. SAM.gov's System for Award Management. This one's run by a different agency, the GSA, General Services Administration. Now, SAM is mainly known for tracking companies and people excluded from all federal contracts, defense, construction, everything.
So not just healthcare.
Not just healthcare. But here's the key part. Its exclusion database now also catches providers who might be suspended or debarred for reasons outside a specific healthcare violation. And CMS actually tells its contractors, if you don't find someone on the OIG list, go check SAM.gov too.
Why? Why the extra check?
Because someone might be barred from all federal contracts for, say, financial misconduct. That would show up on SAM.gov before maybe a specific healthcare exclusion hits the OIG list. So SAM.gov can be like an earlier warning signal. It catches exclusions that still mean no federal payment, including healthcare payments.
Ah, okay, so it's broader.
Exactly. Broader and sometimes faster for certain types of exclusions. So the big takeaway, the thing we really need to hammer home, when you're checking staff, hires, partners, you must screen both the OIG LEIE and the SAM.gov exclusion list. An exclusion on either list means no federal reimbursement, period.
That makes total sense,
Exactly.
especially SAM.gov being that wider net. But, okay, what if a practice tries? They really do, but they unknowingly hire someone who's on a list. Is there any leeway? Like, oops, we didn't know.
Unfortunately, no. Ignorance isn't a defense here. Federal law is really clear. There's no exception for unknowingly employing someone. The second that person is on an exclusion list, any services they provide are simply not payable by federal programs.
Not payable. Full stop.
Full stop. It's not about if you get caught. The service itself is invalid for federal payment from the moment of exclusion. And worse, the practice itself, the employer, faces really hefty penalties. The government basically says it's your job to know who you're hiring and billing for. The responsibility lies with the practice.
Okay, so the stakes are incredibly high. Let's talk about that bottom line. What are the actual penalties? Hefty sounds bad, but what does that mean in, like, dollars and cents?
It means potentially devastating amounts. First, like we said, if an excluded person works there, even volunteers Medicare and Medicaid just won't pay for their services. That backlog of denials, that's real. But then CMS can revoke the entire practice's billing privileges for everyone.
Just based on that one person?
Based on that one person. It's not just a billing hiccup, it's a major compliance failure. And for smaller clinics, losing Medicare and Medicaid enrollment, that can genuinely be a death sentence financially, as you said. Your main income streams just dry up.
Okay, that's terrifying. But what about the fines, the direct penalties?
Right, the fines. Federal law allows for what are called civil monetary penalties, or CMPs. These can go up to $10,000
Okay.
per service rendered by that excluded person.
Wait, $10,000 per single service, not
Yeah.
per day or per claim?
Personal service. Think about a physical therapist seeing, say, 8 patients in a day. Each treatment could potentially be a separate service. That's $80,000 in potential penalties for one day's work by one person.
Oh, gosh.
These penalties were actually increased significantly after some major fraud cases to really deter this kind of thing. It reflects how seriously the government takes protecting these funds. For a small clinic, if this goes unnoticed for even a short time, you could easily be looking at tens, maybe hundreds of thousands of dollars in fines. It's absolutely crippling.
Yeah, you do the math. A therapist seeing 10 patients a day, 5 days a week, that's potentially $500,000 in CMPs per week. That's astronomical. It really is an existential threat.
It truly is. And the OIG, they're very direct about it. Their official guidance says, and I'm quoting here, anyone who hires an individual or entity on the LEIE may be subject to CMP liability. To avoid CMP liability, healthcare entities should routinely check the list. Crystal clear. And again, we have to stress, checking SAM.gov is just as vital for the reasons we discussed.
Okay. This is incredibly serious stuff. Given how catastrophic the consequences are, what can clinics actually do? What are the best practices to stay compliant and just avoid this whole nightmare? Prevention has to be the focus.
Prevention is absolutely everything. It's the only way. Because these lists change, they update frequently. Usually monthly ongoing monitoring is critical, not just once, but continuously. Compliance experts all agree. You need monthly checks. OIG, SAM.gov, and importantly, don't forget any relevant state Medicaid exclusion lists too.
Monthly checks of all three.
Ideally, yes. It's a continuous, proactive process. So let's talk specifics. Best practices. Number 1, monthly checks. Put it on the calendar, make it someone's job, whatever it takes. Download or query the latest OIG, LEIE, and SAM.gov records every single month.
Yeah, monthly. Got it.
Number 2, include everyone. Screen all your staff. Clinicians, obviously, but also support staff, admin folks, even your third-party billing company or contractors. Anyone whose work touches a federal claim could potentially create liability.
So receptionists, schedulers, everyone.
Everyone connected to the process. And third, document everything. This is so important. Keep records of every check you run. Dated screenshots, downloaded reports showing no matches found, whatever works. This is your proof, your evidence of due diligence if CMS ever comes knocking for an audit.
That documentation part sounds crucial for proving you're actually doing it. Now, you mentioned monthly checks. I can easily see clinics thinking, okay, maybe once a year is fine, or we checked when we hired them.
Yeah.
Is that really not good enough?
No, absolutely not good enough. Checking just once a year or only at the time of hiring is leaving a massive gap. Someone could be added to an exclusion list in, say, March, and if you only check annually in December, think of all the non-payable services and potential penalties racked up in those 9 months.
Right. The risk accumulates.
Exactly.
Right.
Consistent, regular, monthly monitoring, that's what makes the difference between being proactive and catching something early versus reacting to a crisis after getting hit with denials or an audit. It's about staying ahead.
That makes complete sense. Okay, let's shift gears slightly and tackle some practical questions that you, listening right now, might have. First off, SAM.gov. We keep mentioning it. Can you just explain again, in simple terms, what it is and why my specific clinic should care about it, besides just the OIG list?
Sure. So, SAM.gov, System for Award Management. Think of it as the federal government's master list of who is not allowed to receive federal money for any reason, contract fraud, criminal convictions, etc., across all agencies. It includes an exclusions database.
Okay, the master do not pay list for the government.
Pretty much. Your clinic needs to care because, like we said, CMS treats a SAM.gov exclusion the same as an OIG exclusion when it comes to payment. An exclusion there means you can't get paid by Medicare or Medicaid. And CMS guidance even tells their own people to check SAM if the OIG list is clear. So it's a separate vital check. Someone could be debarred for something totally unrelated to healthcare, like tax evasion involving federal contracts, but it still makes them ineligible for any federal funds, including Medicare.
Got it. So second question, how often should these checks really happen? You said monthly is best practice. Is that the minimum standard?
Yes, monthly is the widely accepted best practice. Both the OIG, LEIE, and the SAM.gov exclusion data are updated frequently, often monthly. Plus, remember, the Affordable Care Act requires states to send new Medicaid exclusions to the OIG regularly. Things change fast. Monthly checks are really necessary to catch new exclusions promptly before they cause major issues.
Okay, monthly it is. Now, what if the worst happens? Despite checking, you find an exclusion for a current staff member. What is the absolute immediate first step?
Panic is understandable, but action is key. First step, without question, stop billing immediately for any services provided by that person. Don't submit another dime for their work to any federal program.
Okay, stop the bleeding. Then what?
Then you need expert advice, fast. Consult your healthcare attorney or a compliance specialist. They'll guide you. Usually, the excluded person has to be removed immediately from any role involving federal healthcare programs or patients. And you might need to consider self-reporting this to the HHS OIG.
Self-reporting. Why would you do that?
Because the OIG has a self-disclosure protocol. Coming forward voluntarily can potentially lessen the penalties compared to them discovering it during an audit. It shows good faith. But definitely get legal advice before doing that. Early decisive action is critical.
Makes sense. What about commercial insurance, like Blue Cross or United Healthcare? Do they really care about these federal lists? Isn't that just a government thing?
No, they absolutely care. It's not just a government thing anymore. While every contract is different, many major private payers now include clauses requiring that providers in their network are not federally excluded.
It's in the contract.
Often, yes. If they find out you have an excluded provider, they could deny claims, demand money back for past payments, that's called recoupment, or even terminate your contract altogether. So yeah, staying clear of federal exclusions is usually vital for your commercial contracts, too. It's foundational.
Good to know. And last question here. Can someone who gets excluded ever get back in? Is it a lifetime ban?
Not necessarily a lifetime ban, but it's a long process. After the mandated exclusion period ends, often 5 years, sometimes much longer depending on the offense, the person can apply for reinstatement with the OIG.
Apply for it. It's not automatic.
Definitely not automatic. They have to apply, and the OIG reviews it. If they are successfully reinstated, then they can try to re-enroll in Medicare and Medicaid. But the crucial point for practices is never assume someone is reinstated. You must always verify their current status directly with OIG or SAM.gov before hiring or letting them bill. Always check.
Always verify. Got it. So wrapping this up, it's incredibly clear that checking SAM.gov and the OIG list isn't just, optional compliance paperwork. It really is a fundamental insurance policy for your practice's financial survival.
Exactly right. It's not busy work. It's core risk management. The OIG is blunt. Excluded providers can receive no payment from federal healthcare programs, period. Doing these checks diligently, month after month, lets you focus on your patients, on providing care, instead of living in fear of audits or those crushing penalties. It really does buy peace of mind.
It absolutely does. So as you finish listening and go about your day, maybe just take a moment. Consider the true cost of not knowing. Thinking back to that clinic we started with, what hidden risks might be lurking in your practice right now? And what small, consistent action that monthly check could save you from a potentially practice-ending penalty down the road? It's definitely something worth thinking about. Thanks for joining us on this deep dive.